Welcome to today's video on phantom limb syndrome, a topic that combines mystery, neurology, and the resilience of the human mind. Have you ever heard of someone feeling pain or sensations in a limb that's no longer there? That's phantom limb syndrome, and it's a condition that has perplexed scientists and doctors for centuries. When a person loses a limb through amputation, they often still feel that the limb is there. It's almost as if their brain refuses to acknowledge its loss. Imagine feeling an itch on a hand that no longer exists, or experiencing pain in a foot that's missing. These sensations are very real for those experiencing phantom limb syndrome. So what causes this phenomenon? To understand, we need to dive into the brain's structure. You see, our brain has a map of our entire body, known as the somatosensory cortex. When a body part is amputated, the area of the brain responsible for that part doesn't just shut down. Instead, it starts to get taken over by adjacent areas. This remapping can create a virtual presence of the limb that manifests as phantom sensations. One of the most fascinating aspects of phantom limb syndrome is the type of sensations people experience. These can range from tingling and itching to severe pain. The pain can be excruciating, and for some, it's a persistent problem that impacts their quality of life. What makes this even more intriguing is the role of the brain's plasticity. The brain is incredibly adaptable and capable of reorganizing itself. When a limb is lost, the neuroplasticity of the brain kicks in, but the reorganization doesn't always go smoothly. Sometimes this reorganization can lead to erroneous signaling, causing those phantom sensations. But it's not just sensory experiences that make phantom limb syndrome so remarkable. There's also a psychological aspect to consider. For many, the limb isn't just physically present, but emotionally and symbolically significant. The loss of a limb can be traumatic, and the presence of phantom sensations can sometimes be the brain's way of coping with this trauma. Now, you might be wondering if there's any way to treat phantom limb syndrome. While there's no one-size-fits-all treatment, there are some fascinating therapies out there. One of the most well-known is mirror therapy. In this therapy, a mirror is used to create a reflection of the existing limb, giving the illusion that both limbs are intact. This visual feedback can sometimes trick the brain into reducing or eliminating the phantom sensations. Another interesting approach is the use of virtual reality. VR can create immersive environments that simulate the presence of the missing limb, providing visual and sensory feedback that can help in recalibrating the brain's map. There are also medications and nerve treatments that aim to address the pain component of phantom limb syndrome. These include everything from painkillers to nerve blocks, although their effectiveness can vary from person to person. As science advances, researchers are looking into more targeted treatments. Brain-machine interfaces, for example, offer a promising avenue by potentially allowing direct communication between the brain and prosthetic limbs, reducing the mismatch in brain signaling. Phantom limb syndrome is a window into the brain's complexity and adaptability. It shows us how our minds are intricately connected to our bodies and how they manage to cope with profound changes. The study of this condition not only helps those who suffer from it, but also provides valuable insights into neuroplasticity and the human experience. Thank you for watching. If you found this video fascinating, don't forget to hit the like button, subscribe, and turn on notifications so you never miss an upload. Leave a comment down below if you have any questions, or if there's a topic you'd like us to explore next. Until next time, stay curious.